So I've been asked to talk about what I thought may be relevant. I thought maybe high blood pressure would be the best because it's actually one of the most common problems that we have in not only in Malaysia, but everywhere around the world. So as you will see in a short while, I will try to address common things that we ask your doctor about blood pressure so that you have a better understanding about this disease process and how actually this condition can be managed. And as you see from the title, I think we were aware of the so-called controversy or the hoo-ha that came about because someone decided that we can control blood pressure by going to the barber. So we'll see whether that is actually possible. Okay, so you know the story during the MCO, everyone just couldn't wait to get a haircut because this is almost looking like our ancient Neanderthals with all the long hair. So this one particular guy, you will see this person here, you know who he is. Dr. Afif is one of the assemblymen from Seberang Jaya up north. So he wanted the government to relax the MCO ruling and allow the barbers to open. And he is actually qualified as a medical doctor, though he's practicing as a politician right now. And so he decided to quote that there was one medical manuscript that proposed the possibility of getting blood pressure control by going to the barber. So everyone got very excited, you know, and you will see properly this guy here and these few guys here, look at their hairstyle, all the same, huh? One line only. I guess it must have gone to the same barber. So it was very, sort of got everybody excited because the journal that he quoted was one of the most famous and popular and most prestigious medical journal in the world. So for a journal to publish a manuscript to say that you can lower blood pressure by going to the barber must be something. So some of you ladies who are there, if your husband or your son goes to the Indian barber, in Malaysia or anywhere Indian barber, they're very special because you get a lot of extra services. So it's not just the haircut that they go for, they got this special massage. They also get the massage to the scalp, to the neck, and the best part is this guy on the right, the neck cracking. So everybody look forward to that. Of course, they hope they don't pull your neck off. This is the extra services. So how is it possible that this kind of barber services can lower your blood pressure? Do you think that it's because cutting hair is somehow magical, there's some effect that can lower the blood pressure, or because after the haircut, he looks better, more handsome, so he feels good, and so naturally blood pressure will come down? Or is it the actual massages that help the blood pressure to come down? Or maybe because the doctor says so, the so-called doctor says so. So we'll come to that, and we will then see whether this theory is true. But let's run through some of the things that we're going to talk about in the next maybe 15-20 minutes. We would like you to understand what are the numbers, what do they mean when you measure your blood pressure. We will briefly look at the history about high blood pressure and our attitude towards high blood pressure and how we actually manage it and the impact to all of us. We'll look at how to properly measure your blood pressure and how to define whether you truly have hypertension and how we can actually lower the blood pressure. So what are these numbers? So very commonly, many of us have this blood pressure set that you monitor yourself at home. There is this upper number and this lower number. The upper is called systolic, the lower is called diastolic. Usually these monitors will give you the last number is actually the heart rate. So the upper, the so-called systolic blood pressure, is the blood pressure that is derived at the point when your heart is contracting. And when your heart relaxes, there is still a pressure that is due to the tension in the big vessels in the body that is called the diastolic blood pressure. So the two most important readings are the systolic and diastolic blood pressure. We need to know both. Both these levels are important regardless of your age, though when you are older, you're more likely to get a systolic hypertension, meaning that the upper one tends to be higher. When you are younger, it can be both, can be raised, all right? Now, this hypertension is not a new disease. Do you know that the first manuscript or medical journal was actually this Huang Ti Neijing? This is a classic description of disease conditions from the ancient physicians of China 5,000 years ago. And they describe that when the physicians felt the patient's pulse, when it's hardened, it means that the patients would they're actually describing thickening of the vessel due to high blood pressure. And they also describe that if you leave it long enough, when the arteries or the vessel become too hard, they also get leg swellings. They are actually describing the complication of hypertension, which is heart failure. So amazing, it has been actually known 5,000 years ago. There were very little available to treat high blood pressure. Today, we are still using some of this, like some of you go for this kind of cupping around your back. You see all these marks all over the place. And in the olden days, they actually put leech or even cut and bleed you. Basically, when you bleed, you lose your blood and then your blood pressure will drop. So I'm happy that we don't have to do this in our patients today. And every time you come and see a doctor, we have to bleed you just to lower your blood pressure. But we have also changed very much in terms of our attitude. As even like 50, 60, 70 years ago, at that point in time, blood pressure was considered something that is benign. Even a pressure of up to 210 systolic, 110 diastolic was thought to be safe and can be left alone. In fact, there are some doctors at that time who believe that the blood pressure is not a true problem, but it's actually all from the head. Now, if you want to ask what happens to a person who has a blood pressure that is not treated or controlled, I think the best or classical example can be seen from the history of one of the presidents of the United States of America, President Franklin Roosevelt. In 1930, in his late 40s, his blood pressure was normal. Then around age 54, his blood pressure was 162/98. The presidents have their own personal physician, and at that point, there was no treatment that was given because they thought it was fine. A few years later, the blood pressure has gone up further, and at that time, what can they give? They give massage and give him something to sleep or sedation, phenobarbital. By about another 7, 8 years from the time of diagnosis, he was already having heart failure. At that time, it was just low salt diet, maybe rest, and to restrict the president's intake of alcohol and cigarette. In 1944, he has already had a number of strokes. And in 1945, that's towards the end of World War II, his blood pressure was 260/140. He attended a meeting in Germany, I think it was in somewhere in Eastern Europe, in old Russia, where the leaders of the world were meeting to decide what to do with the Germans. And Winston Churchill, the Prime Minister of UK, looked at his friend, Franklin Roosevelt, and said he's very ill. So Winston Churchill asked his own physician to have a look at the president. And this was the verdict of Lord Moran, which is Churchill's physician. This president is very ill. I will not give him more than a few months to live. And true enough, 2 months later, he died suddenly. He died suddenly of bleeding in the brain, massive bleeding. And at the point before he died, his measured blood pressure was 300/190. So the whole spectrum of complications of untreated hypertension can be seen in the president of the United States of America. So how do you treat hypertension? In 1940s, as I said, there were very little available. At the time, they suggested maybe you can try watermelon, cucumber seed, garlic, and so on. And patients were advised to avoid red meat and sex. Very difficult to follow, isn't it? I'm sure it won't happen today. So we know that hypertension is bad. We have been very bad in terms of getting the patients under control long time ago. Today, if you look at the main causes of death in the world, it is still cardiovascular disease. Now, cardiovascular disease basically refers to conditions affecting the heart and all the vessel systems in the body, right? That is the main killer worldwide for the last 20, 30 years, 2 to 3 decades. So it can manifest in the heart, it can manifest in the brain, or it can manifest in the vessels anywhere, including the legs. including the kidney as well as in the genital or the sexual organs of the person. In Malaysia, this is the latest statistics from the Ministry of Health. The main cause of death is again cardiovascular, that includes heart disease and stroke. 1 in 4 deaths in Malaysia is still due to these two conditions. Now, if you look at this then, the causes of this kind of cardiovascular death, there are many risks to get cardiovascular disease. And the top is still high blood pressure. And this problem is particularly serious looking at the orange bars in this Asia and Southeast Asia region. So it is no doubt that it is a major problem for many years, and it will continue to be so. About 1 in 10 deaths worldwide is due to hypertension, and it is actually worse in the low and middle income countries. In fact, the worst burden is actually in Asia. 1 in every 3 adults in Southeast Asia are noted to have elevated blood pressure. In Malaysia, 3 out of every 10 persons actually have high blood pressure. The problem is, for every 2 persons that know or are diagnosed with high blood pressure, another 3 have undiagnosed or are not aware that they have hypertension. And those who are, so the last statement is actually only half of those who are aware are actually treated, and less than half of these have their blood pressure under control. So as I said, there are many sort of outcome or complications of blood pressure. The worst that we are worried about is risk of stroke, even dementia, memory issues. You may have problem with your vision, we have bleeding in the eyes, you can get heart failure, kidney failure, heart attack, you can have sexual dysfunction as well. And there's a blood vessel in the body, which is called aorta, which can enlarge and can rupture and cause sudden death. So these are the major issues or complications of untreated hypertension. So a lot of us will want to know why then we get hypertension. Most of the time, we don't know. 90% of the time, we call it essential hypertension. We don't really know the cause. It's probably multifactorial. It can be related to your genes, multiple hormonal issues, and so on. In the past, the term essential came from the fact that in the days of old, we thought it is normal, it's essential for you to have a high blood pressure as you grow older. But this is no longer true, but the terminology stays. Only in 1 in 10 person with high blood pressure, there may be an underlying cause. The usual ones that we want to rule out will be kidney problem, people with some hormonal problems, including thyroid. There are some people, especially the ones who are obese, they have what we call sleep apnea. These are the people who snore loudly when they sleep, and sometimes they get obstructed airway. They actually stop breathing when they are sleeping. That can cause hypertension. Be also mindful that there's a few medications that can cause elevated blood pressure. Some simple things like cold medications for blocked nose can actually cause elevations of your blood pressure. Some people are sensitive to some of the painkillers that can also increase your blood pressure. Ladies who take contraceptive pills, some of them can also develop high blood pressure. Of course, some drug users can also have elevated blood pressure as well. When you have essential hypertension, we don't have an actual cause, but we have what we call risk factors. If you have these conditions, you're more likely to develop hypertension. So some of these factors may contribute to the development of hypertension. These include chronic cigarette or heavy smoking, overweight or obesity, lack of exercise, if you take a lot of salt in your diet, not enough potassium in your diet, excessive alcohol intake, stress. This is not a clear relationship, but of course, acute stress can cause a transient elevation in blood pressure. Chronic stress maybe can cause elevation of blood pressure. Age, because as you grow older, your vessels get stiffer, that can cause hypertension as well. And of course, genes. We know that high blood pressure runs in the family. If your parents, your siblings have high blood pressure, you're more likely to develop high blood pressure in your lifetime. Of course, certain races are more prone to high blood pressure as well. Some ladies during pregnancy can develop what we call pregnancy-induced hypertension. Now, then how would you know whether your blood pressure is elevated? Many a times my patients will come and tell me that I know when my blood pressure is high. I will have headache, I get giddiness, and I get this stiffness in the neck, and so on. So even if you go to the net, there's so many websites that tell you about symptoms of high blood pressure. This is one of them that I got. You get headache, dizziness, heart problem, and even nosebleed, and so on. Well, yes, maybe, but actually, most of the time, I would say maybe 90-95% of the time, there is no symptom whatsoever. Your blood pressure can be in excess of 200 totally without knowing. That is why we call hypertension a silent killer, because it doesn't have symptoms most of the time, right? More likely, when you have, let's say, some headache, some dizziness from whatever cause, and then you check your blood pressure, it will be high, because any bodily discomfort can cause elevation of the blood pressure. So instead of blood pressure causing those symptoms, it is those bodily discomfort that cause your blood pressure to go up. So what is the only way to know whether you have hypertension? You have to measure your blood pressure. No other way, right? You have to have a blood pressure set to monitor the blood pressure, whether by yourself or by your physician. So let's look at how to measure, what are the devices that's available to measure blood pressure. The first device that has been sort of created to measure blood pressure is actually created by an Italian doctor. At that time, the measurement is somewhat like what we are doing now in your doctor's office, but they only measure the blood pressure by feeling. So you can only measure the upper level of the systolic blood pressure. But the first demonstration of blood pressure is actually by this scientist or physician in the 18th century, where he actually punctured the artery in the neck of a horse and put in a glass tube and see the blood going up. So that elevation of the blood pressure actually is a measurement of the blood pressure. Today, we have many devices that's available. Of course, the usual ones that you see in your doctor's office and some that you can measure at home. If they are well calibrated, they are fine. They are equally good. So it doesn't really matter. In fact, some of you may have some of these wearable devices, some of the watches that are supposedly able to not only check your heart rate, check your activity level, but also measure blood pressure. There are also devices actually called like suspenders that can wear blood pressure. I'm not actually sure which part of the body they are actually measuring, but mind you, none of these wearable devices have actually a medically certified grade in terms of the reliability in measuring blood pressure, okay? Right, you have to be aware of that. So, how do you actually, now that you have the device, how do you actually measure blood pressure? So some of you think that this must be a stupid question, isn't it? Because what do you have to do? You have the device, just put it on and press the button and it measures. Well, yes and no, because measuring blood pressure is simple, just press a button, but there are certain rules to follow, right? Some things is easy, but many of us actually not doing it properly. There are also things that you should know about how not to measure your blood pressure. You do not measure your blood pressure when you are excited. You do not measure your blood pressure when the person is in pain. Of course, you're going to have a gross elevation of the blood pressure. It has to be measured at a proper time when the patient is well rested. So there are guidelines, even from the International Societies of Hypertension to doctors on how to measure blood pressure, because there are some common sense things that we have to follow. For example, you're supposed to measure the patient when they are rested for at least 5 minutes. They are seated with their back rested, not on a stool, rested with both feet on the ground. They're not talking. They have not had any cigarette in the last half an hour. They have not had a coffee. They have emptied their bladder. So simple things like that need to be sort of adhered to before you measure the blood pressure. Even the CDC have an advisory for those of you who are measuring your blood pressure at home. You do not come back from home and quickly sit down and just measure your blood pressure. It's going to be high, which is why some of you who measure your blood pressure and you complain that it's high, but just relax, rest, repeat the measurement, you find it will come down. So you have to measure the blood pressure in a resting state, okay? Because some of these small things, like even making sure that you're rested, matters, because it can actually change or make a difference in the blood pressure measurement by as much as 12 systolic and 6 diastolic. measuring the blood pressure using the right size, and so all this matter. So it will take some time to measure if you do it in the clinic, but this is the proper way of measuring blood pressure. So next question then, is the measurement at your doctor's office is more accurate than yours at home? Yes and no again. One is the device must be well calibrated, but we also know that today doctors are starting to emphasize that sometimes we would like the patients to have their blood pressure monitored also at home, either with a home blood pressure monitor, or we sometimes get the patient to bring a device that is put on for the next 24 hours. This device will measure the blood pressure throughout the 24 hours, every half hourly, even when the patient is sleeping. So we get a 24-hour pattern. Why do we do that? Because we realize that there are some patients, for example here, when they measure the blood pressure in the clinic, is more than 140. But when they go home, this is the 24-hour blood pressure monitor, they may be normal. So these are the people whom we call have white-coat hypertension. The pressure is only high when they come to visit the doctor or come to the clinic, but at home it is normal. This is called white-coat hypertension. Worse is, some people have low blood pressure in the clinic below 140, but at home the blood pressure is high. This is called masked or silent or undiagnosed hypertension. These are the worst group, because if you look at these people with masked hypertension, here means undiagnosed, only blood pressure high at home, they're not diagnosed in doctor's clinic, they have their hypertension that is not treated. This patient have higher risk of heart disease or death due to hypertension. Whereas those with what we call white-coat hypertension, only blood pressure being high in the clinic but normal at home, their risk of cardiac problem or death is the same as a person with normal blood pressure. The only thing is that if you have white-coat hypertension in your lifetime, you're more likely to develop true hypertension. Now, this white-coat thing is a true phenomenon. You cannot control. This is a very nice study done by a famous doctor who's actually monitoring high blood pressure. So what he does is that he puts a cannula into the patient's artery, so we can actually measure the patient's blood pressure. Every bit, he can measure bit by bit. So the patient is rested, a doctor walks into his room, without talking to the patient, just walk into his room and see how the patient's blood pressure goes up. No interaction between the doctor and the patient. The doctor walks out, the blood pressure goes back to normal. So this is a phenomenon that is true. It is subconscious. And we find that if you have white-coat hypertension, every time you go to see a doctor, your blood pressure will be high. Even though he's your regular doctor for many years, you still have the white-coat effect. So then, now we come to, now that we know how to measure the blood pressure, when do you call it hypertension? Most of the guidelines tell us that we define high blood pressure is when you have a level of more than 140, the upper one, and more than 90 if you measure in the clinic. This is the European guideline. If you measure at home, most measurements should be less than 135/85. Above that, that's considered hypertension. In Malaysia, we use the same kind of threshold, 140/90 in the clinic to define hypertension, right? But the controversy is this. If I tell you there's 140/90, some of patients or even normal people have the idea that, 140/90, but my pressure is 135, 139, low is 88, 89. I don't have hypertension. So that means I have no risk. This is a concept that the definition or the threshold for diagnosis of hypertension is used to simplify the management. In a macro kind of scale, in a big population, we have to define when we start treatment of hypertension. But if you talk about risk of high blood pressure, look at this. Assuming that your blood pressure is 115/75, that is considered, let's say, normal risk. Every 20 millimeter increase in the systolic and 10 millimeter increase of the diastolic, as your pressure goes up to 135/85, which is still considered normal, your risk is already double that of 115/75. And another increment of 20/10, your risk goes up double again. So this risk of hypertension is actually a gradual risk. The higher the blood pressure, the higher your risk. There is actually no threshold say, above this you have risk, below this you have no risk. It's an incremental risk. And for every level of blood pressure, the older you are, the risk increases. Here, the risk is correlated to the risk of getting a stroke and heart disease. The higher the blood pressure, especially the older you are, the higher the risk of death due to these conditions. We also want to highlight that for blood pressure, you don't have to do very much. Even small reduction in your blood pressure does a lot. 2 millimeter reduction in your systolic blood pressure, you have a 7% less risk of death due to heart disease and 10% less death due to stroke. So treating blood pressure is actually very rewarding. You don't have to do very much, but you do have a lot of prevention or reduction of risk. How low do you bring your blood pressure then? Today, we tell doctors to try to get their blood pressure down. We say 140/90 is the threshold. So we want the patient's reading to be mostly in the range between 130 to 140 and the bottom one between 70 to 79. Keep it there and not above that. So that is a simplified range that we are targeting. Okay, of course that target is different for certain different groups of people. Sometimes if you're older, we are not so aggressive and so on. But in general, aim 130, 140, the systolic, and bottom 70 to 79. How then do you control high blood pressure? Of course, medications. Medication is the mainstay of therapy because it is proven that it can lower blood pressure. It has been proven to prevent complications of high blood pressure. It has been proven to save life. There's so many types of medication available. Over the years, we have lots and lots of medications. A lot of us are very resistant to take medications. Well, understandable. Who wants to take medication? But if you have confirmed high blood pressure, and if your blood pressure is high enough, and if it cannot be controlled with lifestyle alone, you need the additional help of medications. All right? We must understand that we can, to some degree, lower your blood pressure with certain lifestyle changes that we are going to talk about. But the mainstay or main benefit is going to be from controlling blood pressure with certain medications. We have lots of medications. Some of you are afraid of side effects of medications, but there's not much to worry because we have so many medications available. Some may have some side effects, this and that. We can play around with the medications, we can play around with the doses. The more important thing is to control your blood pressure rather than worry about taking medications or taking the number of medications, because that is the most important thing, all right? Don't worry too much about side effects because that can be managed as well. If you look at the clinical trials or how doctors assess whether they can control blood pressure, we know that we are very successful. Many of these trials, we can actually bring the blood pressure down to 130, 140, to the goals that we want. Okay, of course, with that, very often you're going to need 2 or more medications to keep it under control. Also remember that high blood pressure is not a curable disease. When we control blood pressure with lifestyle and medications, we control it only. That is why we are not treating cough and cold. When your blood pressure is under control, if you remove your blood pressure, it's going to go back up again. So we are only controlling, remember, which is why then you need to take medications lifelong. Also remember, as you grow older, your blood pressure tends to get worse. So having, let's say your doctor has put you on certain prescription, let's say 1 or 2 medications, it does not mean that you're going to be on the same medication, same dose for the rest of your life. As you grow older, as your blood pressure gets higher, your doctor will need to titrate and adjust your medications accordingly to control your blood pressure better. So, which is also, again, is the emphasis that having a diagnosis of blood pressure, you cannot just continue to just go and refill your prescription for years at the pharmacy without checking and also seeing your doctor for monitoring. Remember that when you bring your blood pressure down here in these many trials, they look at all the different trials using many drugs to try to lower your blood pressure. The more you lower your blood pressure, the lower your risk of dying from heart disease and stroke, regardless of whatever medication that you take. So the primary thing is get your blood pressure down rather than worry about what medication that you're going to take. But in real life, are we actually controlling the blood pressure? Now, this is a very big trial. 140,000 patients were tested. Patients who were actually aware of that they have high blood pressure, only half of them. And only half of these are actually treated. Even those who are treated, only again, another 1/3 have their blood pressure under control. So we're actually doing very poorly. This is a survey from a number of countries. Most countries, in terms of control of blood pressure, no more than 20 to 30% of their population with high blood pressure have the blood pressure under control. So why is it that we know that in the clinical trials, we can bring the pressure down in most of these patients, but in real world, we're not doing so? There must be something wrong. It's not because the blood pressure medicine are not good. It is something else. The problem is this. We know that for many diseases like high blood pressure, cholesterol, heart disease, diabetes, the doctors may prescribe the medicine. Only maybe 8 out of 10 of them actually go and buy the medicine. But even when they buy the medicine, not all of them take the medicine. And the worst part is we know that statistics have shown by half a year, 6 months later, less than half of these people are still on the medication. So many a times, patients do not take the medications as prescribed. If you ask them, why are they not taking the medications? Some say they do not believe in the medication, they don't think that they need it, or they thought they feel better, the blood pressure has come down, so you don't need to take any more. Many times, they just say, because I forget. Simple things, I forget to take the medications. Partly because high blood pressure, you have no symptoms. So a lot of the reasons why patients do not persist with the medication is actually a behavioral problem. It's not so much we don't have enough sort of good treatment to control the blood pressure. In the clinical trials, we are successful because these patients in the clinical trials are closely monitored. There's actually a nurse coordinator that will call the patients, have you taken the medicine? Some of the clinical trials are very sophisticated. They have some devices that the patient can remind them about taking the medications. When the patients come back for follow-up, they check how many pills are left, then they know whether they are taking the medications. Some even have their blood tested to see whether they have taken the medications. So patients take medications when they are reminded and when they are monitored. So let's now then come back to this haircut story. This is a journal called the New England Journal of Medicine. In this sort of study, not a big study, they look at patients who go to the black barbers who have high blood pressure. In half of these sort of barber shops, they place a pharmacist. This pharmacist would actually measure the patron's blood pressure. He would actually prescribe blood pressure medications, encourage lifestyle changes. And the other half of the barber shop, no such treatment. And so what happens? Of course, in 6 months, those who had a pharmacist intervention, their blood pressure after 6 months is lower compared to before, whereas those who have only their haircut as the extra treatment, no change in the blood pressure report, in the blood pressure readings. So obviously, was it the haircut that lowers the blood pressure? Not actually. It is what we doctors call the Hawthorne effect. This is actually an experiment in 1940s in Chicago. There was this factory that produces spare parts of the phone. So when they dim the lights, when the workers know that they're not being observed, their productivity drops. When they increase the lighting, then the productivity goes up. And then when they dim the lights, productivity drops again. So it's just like it's a human behavior. If you are observed or they are aware of being observed, you will be more sort of compliant with the whatever you're supposed to do or taking the medication. So this is the Hawthorne effect. The barbershop effect is because the patients are monitored for their treatment and their drug taking. We must also remember, although we talk about medications, blood pressure control is not just about drugs. This is only part of it. The mainstay of treatment, all of these patients, whether you are on medication or not, you must adopt some healthy lifestyle. We have some studies to show that if you take diet that is high in fruit and vegetable, low salt, this is basically high potassium and low salt, low fat, you can reduce your blood pressure. Cut down on salt. Some people are very salt sensitive. 5 to 10% of the population see that a lot of these crisp potato chips are very high in cholesterol. So a lot of the fast food, all your soya sauce that you put, chinchalo, remember you add all your asam buih when you take your guava or apple or whatever, ikan masin, belacan, remember those are all hidden salt. So you got to be aware of that. No added salt as much as possible. A lot of the food outside are high in salt because they make the food more tasty. The food that you cook tend to be more plain, right? Exercise is very important. You must make time for exercise. In our modern lifestyle, we take the train, we drive, caught in a jam, we don't exercise. Whenever you have the opportunity, make time for exercise. Most days of the week, 4 to 5 times a week, at least half an hour a day. Okay, even exercise on the way if you are sitting on the train. Weight is a big problem. In Malaysia, we have a high weight issue. Nearly half of the population is either overweight or obese. In fact, for many years, we've been actually obese for all the reasons. We have also good food in Malaysia. And for the last 10 years, we are the heavyweight champion in Southeast Asia. So there's a big issue. Not only high blood pressure, you're going to have problem with cholesterol, diabetes, and so on. Some of us may take alcohol. It's not to say that it's not allowed, but it's the quantity. If you take a lot of alcohol, especially alcohol binge, your blood pressure tends to go up. So not more than what we call 2 units a day for men. That will be about 2 pints of beer, a glass of wine, or a shot of whiskey. Because all these things impact your blood pressure. Just by taking care of your weight, exercising, reducing alcohol, your diet, you see that it can actually lower your blood pressure. These things matter. So ladies and gentlemen, I think I have just basically highlighted to you that hypertension has been and always been one, if not the main contributor of disease burden and death worldwide. If you don't manage your blood pressure, it will lead to many, many complications, including death. The problem with blood pressure comes 10, 20 years later. Having no symptom, feeling well now, although your blood pressure is high, doesn't mean you don't have a problem. The problem will come 10, 20 years later. By then, if you want to treat, it's too late. You're going to manage complications. What we want is to prevent those complications from happening, because hypertension is a silent disease and a silent killer. So measure your blood pressure. That's the only way you know whether you have high blood pressure. In general, we want the blood pressure to be below 140/90 if you measure it in the clinic, and below 135/85 if you measure it at home. Lowering blood pressure well is possible and can be very successful. It actually involves commitment from your side to adopt a healthy lifestyle. And if you need medications, be adherent and to commit to lifelong medications, because it is not curable. So you really need to manage it long term to prevent all the issues in many years to come. So with right understanding of this disease process, which I hope you get today, to be more motivated to control your blood pressure, and you have your lifelong partnership with your regular doctor, you can then achieve a successful blood pressure control. Thank you very much. Okay, I'm going to stop my sharing now. I welcome any questions.
Thank you, doctor. Thank you, our Dr. Choo. Thank you very much. Your explanation is very, very clear. So I support a lot of questions I want to ask you. After your explanation, no question already, because everything is in your slide.
Yeah, I saw this question, whether you only take your blood pressure when it's high and not you take. I get this very often from my patients. They would say, I know when my blood pressure is high. Today is high, I'll take 1 tablet. Tomorrow normal, I wouldn't take. What will happen then is if you have high blood pressure, if you take it this way, your pressure will go up and down. Yo-yo up and down, right? What you want to do is to have a regular intake of medication to keep it under control. We also do know that much fluctuations in our blood pressure is no good. It may also confer increased risk of complications of high blood pressure. Okay?
Doctor, I will got one question to ask you. Okay. So for person that not hypertension, so after taking medication, will be one day become he or she will not become a heart attack?
So the whole idea is this, that high blood pressure can lead to many complications, including heart attack, right? And when you control your blood pressure, we will reduce your risk. We cannot say that you will never have high blood pressure. We're not lowering to zero. But if you lower it, your risk for heart attack, kidney failure, heart failure, stroke will be dramatically reduced, up to 20 to 50%, depending on how good you control, and actually when you start your treatment. If you start your treatment late, when you already have some issues or complications, then your risk reduction will not be as great. So you have to start treatment early. Okay.
Okay, thank you. One more question, doctor. So you know we are in life insurance in last week. So recently, I think we have a few patients it's not overweight, it's look very slim, but after have a good sleep, then early, next day morning, bye-bye already. So after this, we call have a post-mortem is due to heart disease.
Okay. Yeah. So we're all very afraid about this, what we call the sudden death, right? Every time you hear this sudden death, then someone in the office, someone you know, sudden death, everybody start to go for a medical checkup. Otherwise, you don't really care. Because the nature is this, I mean, there are many causes for sudden death. The most common one in the population are usually, again, cardiovascular disease, either heart attack or stroke. These are two most common causes of sudden death, right? And the causes of these, many, including high blood pressure, high cholesterol, cigarette smoking, diabetes, sometimes genetic as well. So if you manage or attend to all these risk factors, you try to minimize your risk. The question then is there any sign that you can have so that you won't have this sort of sudden death? For, say, we'll talk about heart attack. 70% of the time, you may be lucky. You have some symptom, you may have some chest discomfort, you have shortness of breath, so you have chance to go and see a doctor to do a check and find whether there's a problem and to treat. 20 to 30% of the time, there's no symptom. The first time you know you have a problem is when you get a heart attack. The statistics tell us that 1 in 5 of these people with a heart attack, they don't make it to the hospital. They have sudden death, right? So it is good that if you have any sort of risk factors, get it managed, treated, controlled. And if you have these risk factors, also do perhaps go some basic screening to know whether there may be any possible disease that you may want to treat. Especially if you've got symptoms like you get chest pain or shortness of breath, get it checked out rather than wait for something bad to happen.
Okay, doctor, there's a question from the floor. Any limitation section in future regarding BP?
What limitation, sorry?
See the question, any limitation section session in future regarding BP?
So I don't quite understand. Limitation section.
You can defer, there's a Q&A, there's a question from the floor.
There was the question is what again? Sorry.
Limitation section.
Limitation section. Maybe you can help me to translate that. What does it mean? Sorry, I just don't quite understand the question. Limitation section. What do you mean?
Murugan, can on your speaker? Our Mr. Murugan. Okay. Understand. Okay. There's a question, not question. They want this section to be repeated again in future.
So request, doctor.
Request only.
They request doctor to give another section about this webinar talk.
Okay. We see my timing. I got too many to give, but we'll make some time maybe. Huh? Right.
Yeah, schedule quite full, eh?
Yeah.
So any question from the floor again?
There's one question I saw from Ling Ling that if you lower your body weight, can your blood pressure drop? As you've seen earlier, lowering blood pressure, body weight can lower your blood pressure, and plus all the other lifestyle changes. I think the question is, some of you want to ask, is it possible that if I control all this, I can stop my medication? Now, most of the time, if your blood pressure is very high, at least you're on, let's say, 2 or 3 medications, very unlikely that just lifestyle changes alone can lower your blood pressure enough to go away with blood pressure medicine. But some patients who have borderline blood pressure, sometimes by just lowering your body weight, you exercise, watch your diet, you can lower enough to stop your medication. Those with more severe hypertension, you may be able to cut down on some of the doses of the medication. So yes, you must adopt some healthy lifestyle because that can help with your blood pressure control. Oh yeah, there's a question if someone wants to go to Tibet. Going to Tibet basically is high altitude, has nothing to do with the high blood pressure. You can actually go. the high altitude sickness can happen whether or not you have high blood pressure. So, and also has no bearing on whether you are a fit person or not. It can happen. So the most important thing is to have maybe acclimatization before you go. So go up slowly if you can. You may want to see your doctor. Sometimes there are some prescription that we may give to try to reduce the risk of high altitude sickness. They mentioned that if the toilet is smelly, will it affect your heartbeat? Well, if the toilet is smelly, you'll be disgusted. Your heart rate may go up, but probably has no problem with your heart or your blood pressure. Not to worry. Okay. Is there any other queries?
Okay. So thank you very much, Doctor. Thank you, Dr. Choo. So thank you all the participants, and thank you. I'm on behalf of Lamdifa Johor. Thank you, Dr. Choo and CVS.
Thomas?
Any more questions? Some more questions.
There's no more. Cholesterol medication is advisable to take lifelong. Okay.
There's a question. High BP will affect our memory power?
Okay. No, not directly, but if you have high blood pressure, it will affect the vessels in the brain. And you know that those who have high blood pressure, especially not controlled, are more likely to get dementia long term. So high blood pressure treatment or control has been shown to prevent dementia. Okay? The medications usually do not affect your short-term memory, but treating hypertension is most important because it can prevent dementia. When you are given a cholesterol medicine, it must be for a certain reason. It is either because you have confirmed heart disease, stroke, or you have demonstrated some cholesterol deficit in your arteries and so on. Or if your cholesterol is very high, then the doctors will prescribe the cholesterol medicine. Treating cholesterol for those reasons are very important because it is very clear that it will prevent future heart attack, stroke. It may prevent the progression of the blockages. So treating cholesterol is like treating hypertension. You take the cholesterol medicine, it will go down, you stop the cholesterol, go back up again. Because 80% of the cholesterol comes from your own body production, your genes. Only 15 to 20% can be accounted for from what you eat, right? So usually if you need a cholesterol medicine, it will be a lifelong treatment, just like high blood pressure. Yes, it's not because you cannot stop. You can stop. When you stop, cholesterol goes back up, your risk goes up. So the reason why you need to continue long-term is because you need to suppress it as long as possible to prevent long-term complications.
Okay. Any more questions from the floor?
I think that's all.
All right then. Okay. Thank you, everyone.
Thank you, Dr. Choo. Thank you.